guys seeing what the data looks like. So really quick, just a synopsis of the drug-resistant epilepsy itself that we're looking at. Anti-epileptic drugs typically in these patients have little or no effect. That was one of the requirements for us to enter the study. It's very common. It occurs in almost 30% of all epilepsy patients, and especially is common in children. Typically, a lot of these patients will be on 3 or more anti-epileptic drugs. For those who are familiar, there's very, very severe, very intense medications. And as a result of not only the epilepsy, but we're finding about the other medications, it causes a hindrance in their quality of life, their ability to develop. Most can't go to school, most can't function normally, and so we see a very strong kind of decline in cognition, and that's also brought on by the uncontrolled seizure activity, and just in general, a major burden both financially and to the overall family and individual itself. And the other kind of interesting perspective of this is sometimes in those cases, surgery does work, especially if there's focal activity, whereas one part of the brain is where the activity is stemming from. But in general, a large portion of these patients have generalized seizure activity. So the activity is occurring all around and throughout the brain, which makes it almost impossible for surgery and very difficult to treat. And so this is the cohort that we kind of focused on for our clinical study itself. So what we did is we began a new physician expanded access program where we provided open label treatment, so no blinding, no placebo controls, anything like that. But we provided this to 33 children in the state of Florida with drug-resistant generalized epilepsy. And we performed this with a 98% pure oil-based CBD extract. I'm sure I'll get questions on what exactly that was, who made it, and things like that. Because we're in the middle of data collection and things like that, I will leave out the names of the companies and things like that who are providing us with that. That being said, if you follow the news or different things like that, you probably figured out pretty fast based on some of the results that I'm going to show you where this is coming from. But it all ties into everything that we're kind of interested in as well. Delivery oral, so this was in sesame seed oil or via gastric tube, and our dosage ranges were pretty high in what you consider for CBD itself. Almost all patients reach 25 milligrams per kilogram per day, and I'll talk about how likely that could have gone higher. That's a very high concentrated dosage. And our goal was to evaluate the safety and efficacy as they were taking it with their current medications. So these are our main aims. Is it safe? Can we give this to kids and have no continued decline in cognition? Does it not increase their seizure activity? Are the adverse events manageable? There's a number of kind of things that we wanted to really be able to answer, but safety is obviously the most important with any drug that's being taken, all the way from medical marijuana to the highest grade pharmaceuticals that we see. And we also wanted to see as a focus, what does it do to the generalized seizure activity? Are seizures reduced? The number that each patient has. Is the severity of those seizures reduced? Those are big questions, right? And that's a really nice, tangible thing that we can measure across time. But what really made this study interesting and something that we were really excited about was we also wanted to see what changes occurred with their daily adaptive behavior. Do they improve in school? Can they learn more? Can they function more? Is their sleep improved? Sleep is a major problem with children with epilepsy. And overall, does their quality of life and social interactions improve as well? We want to see, does it really have the total package, and in what ways are we seeing these kind of effects? So this is a very kind of quick blitz overview of what we did for the study. We just did a 4-week baseline measure where we had the patients record the number of seizures that they had every single day. We had them perform kind of baseline recordings. We performed clinical tests and psych tests to see what their aberrant behavior was like, what their sleep was like, their quality of life, everything just to get an idea of what is life like before using CBD. We had 33 patients, and they were between the ages of 2 to 16. They had a number of different exclusion and inclusion criteria, but the big one was they needed to have a minimum of 4 seizures per month. And typically when I asked that question to the parents, they'd laugh at me because they would give anything to have just 4 seizures per month. And so you kind of get an idea of what this population is like, and we see 2.8 anti-epileptic drugs used per patient. That means that some are using 4 or more, some are using just a handful, but these are additional drugs that really at this point aren't having any positive effect on seizure activity, behavior, anything else, but they're on them because it could keep them stable. So our goal is not only to look at, can CBD reduce seizure activity and improve cognition and a number of things, but can we also reduce the burden of all of these drugs that they're currently taking as well as a replacement? And so I'm just jumping quite literally right into the data of what our results were. So anyway, we measured them for a total of 2 years to record their seizure data. And for the first year, we measured cognition, sleep, pretty much everything that we could to try to determine what is the quality of life changes in these children and how is that changing, how is that improving. So I apologize, we didn't have, like I said, we're moving through the data, so I don't have nice graphs to kind of show you visually, but to highlight, what we really saw was after 3 months, 57.8% of our study group were considered responders, which means more than half of their seizures or more were reduced or gone, which is pretty substantial. We see a number, even 12% across the board, 15% more of those patients had no seizure activity whatsoever after CBD treatment. But what's really interesting to then look at as you kind of go along these study periods is, and a lot of times this happens with a lot of medications in our patients, there's a honeymoon period. A couple months in, it works great, and then it just kind of falls off again. And so what we really wanted to see was what is long-term effect, not just 6 months, but which is really common for a lot of drug studies, but also 1 year. What about 2 years? And so when we look at 2 years, we're seeing that there's still, it actually improved to 63% of the cohort had more than half of their seizures reduced, which is a substantial number. And we're seeing just purely off of seizure activity alone that this is having a positive effect on their seizure activity. Again, we also, to show you the different types of seizures that we measured overall, so there was a median monthly seizures for all of our patients. There was 111.9 per month. So imagine having 111 seizures per month on average across the board. And after 12 months, that was a 75% reduction in total number of seizures across the board. It's astounding. It's really impressive. It really is. And we saw that continue, a little bit of a drop off, but you're still looking at just under 70% of the patients after 2 years are still having seizures reduced. So we're really seeing the long-term benefit occur across the board in the reduction in total number of seizures for these patients. And what's really interesting is you start to look at the individual specific seizure types, and we're seeing substantial reduction in not only tonic-clonic, which is the more severe seizure types, absence, kind of the head drops, atonics and things like that. We're seeing a very consistent reduction in all types of seizure types, and the severity has been reduced substantially. It's really quite impressive. We also did, and I'm just not going to talk too much about this because it was just an interesting thing that we're really starting to dive into is, well, it's fantastic. CBD is clearly having a positive result in seizure activity. What is the result when you're taking it with other medications? What kind of other medications are these patients taking? And what we noticed was that patients who were taking clonazepam or clobazam, diazepam, some of these medications that are existing, they're also having a greater reduction in their seizure activity. And so I don't have the answer to this because, fortunately, as a researcher, I just keep asking questions and try to keep answering them. But the interesting part of this is there a correlation in the type of medications that we're giving? Is it worth exploring, and it seems like it is, what medications could, in conjunction with CBD, have a beneficial effect? Or, not only that, but what medications could be hindering CBD from having a positive effect, or vice versa? And we see that. We've seen, when we do our blood work on our patients, we do see elevated levels in certain, the benzodiazepines, which is a really common group of anti-epileptic drugs for patients. We see an elevated blood serum levels when we give them CBD, which means there's some type, we kind of start to open the door into trying to answer the question of what's the mechanism of action in these types of drugs and CBD in general. Now the really kind of interesting part is, and I'll kind of highlight some of the pieces, I know I'm putting a lot of numbers just up there. We looked at a couple of different, like I said, behavioral measures. The first one is the aberrant behavior checklist. This is a parent-answered questionnaire that they answered. We actually had them do it not only at baseline, but at 6 months and 12 months, but I highlighted just the two. And what we really saw, the pieces that stood out to us the most, and all of our data on that piece at least was on the impaired behavior was significant. We saw irritability decrease, and we saw hyperactivity decrease. And those are, everything decreased, but those two stood out the most, and that really parallels what you might expect from a reduction in seizure activity as well. Less irritation, less stress, less fatigue. We start to make those kind of parallels. We also performed Vineland Adaptive Behavior Scales, which is given by a professional psychologist, and it's also parent responses as well. And our data here was not as substantial in the differences that we saw, but we consistently, a green arrow is positive. So for example, the ABC, a reduction in score is a good sign, is a positive sign of improvement. For the Vineland, increase in score is a positive sign. We just do that just to confuse everyone. And what we did notice though is that we look at socialization, we look at their ability to function in day-to-day type things that kids their age you would expect to be able to handle. And it can be little things from just playing with others at school to, are they making eye contact, are they socializing with their parents, very little kinds of things. And we try to be able to measure those in a very kind of clinical way. And so we see a trend towards improvement. Really at the end of the day, more data is needed to say substantially if that's something that's improved. But the other two scores, and again, I apologize for a lot of the words here, but the other two big scores that really stood out to us are the quality of life score, which as a composite score, we saw a substantial improvement in overall child's quality of life as the parents determine it. That can be included in their just natural function, their ability to understand things, their ability to comprehend language. A lot of these kind of trends over time, we saw consistent improvement across the board amongst all of our cohort patients. And the other really important piece, which I think kind of ties it all together, is we saw an improvement in sleep. So we used the Children's Sleep Habits questionnaire specifically for children with epilepsy, and we found the big pieces that change are daytime sleepiness decreased, night wakings decreased, and their sleep duration improved overall. At the end of the day, and that ties back directly back to both seizure activity as well as just comfort and reduction in stress and anxiety and things like that. Because if a child is able to sleep more, they're less tired, that correlates to less seizure activity, that correlates to better behavior. All these pieces we're kind of seeing are tying together. And then obviously we looked at the safety aspect of it. And some of the that was really impressive was, what are the adverse events of this? You're giving somebody a drug, what are the side effects? And the big things that came out of it were drowsiness, which we do tie to their use of other medications. Because when like we said, if we saw an increase in some of those benzodiazepines in the blood system, you're seeing that increase, that ties a lot with lethargy. So what we found is if we decrease the benzodiazepines, then we see the lethargy change. So CBD caused it, but we were able to change it by changing something else. So it's really positive, and we did see an increase in reports of diarrhea, likely to do with the sesame seed oil, so looking at different avenues and channels for delivering is important. Solomons, agitation, some really small kind of pieces. When you ask the parents, okay, so your child is experiencing this adverse event, is this a concern for you? And their answer is absolutely not. This is fantastic compared to what we've had, And I think that's really important to really kind of see across the board when you start comparing the side effects of a lot of these other medications as well. So my really quick conclusions, I know I just threw data right at you guys, and I can answer questions and talk a little bit about that as well, is we did see a clear reduction in visible seizure activity, where these patients currently have no other options. No other current FDA-approved medications are available to them that will reduce their seizure activity. And we were able to see a pretty consistent, over a 2-year lifespan of the study, reduction in seizure activity. We also saw a trending improvement towards quality of life, sleep, aberrant behavior, social skills, learning, which really kind of not only ties back to just epilepsy, but then we can start to ask questions about autism, Angelman syndrome. We can look at any type of other behavioral disorders that are associated with rare diseases, and we can start to really see that this is not just a one avenue kind of medication, kind of a drug, but could it be used for other things, and what are the variances that need to occur to kind of look at that. There is clearly a relationship between other anti-epileptic drugs, probably other drugs besides just anti-epileptics, and CBD use, but there could be a potential benefit to using them in concurrence, or there could be a hindrance to one or the other. And so that's really something that we need to start diving into. There's some great papers out there that are starting to answer that question, but it definitely is, when you start to treat this as a medicine, the real question that needs to be asked. Very few severe side effects, which is fantastic. We did have a couple of dropouts throughout the course of the study, and most of that just came down to efficacy. After 6 months, for a couple of patients, there was no change in seizure activity, which you expect. But typically, in a clinical study that we would run unrelated to CBD, you expect about 50% of your population to drop out. We only lost 4 out of the initial 33, which is pretty fantastic, which also shows to it. And we showed that, like I said, long-term results over 2 years. So this kind of just highlights what I mentioned, is that when we provided this high-level CBD treatment, we saw a decrease in visible seizures. We began to look at epileptiform activity, so looking at EEGs. That's really another good question to kind of start correlating this all together. Visible seizures are one thing, actual seizure activity going on in the brain is another thing, and so that's a question that we're beginning to answer. But we saw a low level of side effects, we saw some lethargy, drowsiness, and when we kind of then moved on to the next step and we allowed these patients to adjust their current medications, we saw even more improvement in their hyperactivity, even more improvement in their behavior, even in seizure reduction, and then getting them off of those other medications, we saw just a major benefit. Which, I mean, any parent out there who has kids, you want, not any parent, but any adult, the less medications you're on, the better, right? And that's kind of really what we're looking at, and it's can it be a replacement for not just seizure activity, but a number of things. And so this is kind of a snap overview. So really, I mean, at this point in my early career, I've definitely dedicated myself, and Dr. Carney has now begun to advert his career towards this as well, as we're very interested in looking at medical cannabis, not just CBD, which I know was highlighted here, but THC, other cannabinoids, and looking at what are their medicinal benefits. And we think for this particular study, it was open label, the parents knew what they were getting, the children knew what they were getting, and we as the coordinators knew exactly what they were getting as well. There is naturally going to be inherent possible error within that. I will say that the results are astounding enough that I don't believe that to be the case in this situation. That being said, the proper channels are really to look at blinding, placebo controls, to really take this to the next level. I'm sure you've seen papers out there where they have used high-level CBD and they've shown in children who have Dravet syndrome or Lennox-Gastaut, very similar results, very almost identical results to a lot of these things. And so we're starting to answer these questions, but the importance of how we structure these studies is really key. I mentioned we want to look at epileptic discharge. So for this specific kind of study to see, great, we don't see you having a seizure, but you could still be having a lot of hyperactivity, which could be causing a number of other problems as well. So looking at EEG, it also helps kind of cover up some of that. So we were reported the seizures by parents, and you know, parents, we couldn't do it without them. The hard part is that, well, did that look like a seizure? That kind of looked like a seizure. A seizure looks different to dad, mom, grandma, grandpa, their uncles. So kind of making sure that if we can evaluate and we can kind of cross-compare that with the EEG activity, then we can really say a lot about what we're looking at. Relationship with other existing medications, the significance of dosage and safety and efficacy, and also the levels of CBD. So this is 98% CBD, 0.5% THC. There's absolutely studies out there that show that THC can have a benefit, but there's no clinical studies. Like, we're in a clinic where we're actually showing piece by piece this is the true medicinal benefit. And that's what we need to start doing. That's where we see this going. And kind of where I talk about where I do in my career, as well as Dr. Carney, and where we really want to start looking at this focus, and where I see this kind of industry going, is we really feel like there needs to be more clinical studies. And I wouldn't say our study is the the elite of study making itself. It was a very simple question, handled in a very simple way. But when you start to have these double-blinded, placebo-controlled studies with any medical cannabis product, both pharmaceutical grade or anything that you might purchase at your dispensary, they all have benefits. We believe them. We wouldn't be in this room if we didn't believe them, right? And we know we can see it. And so what we really start to say is we need to understand how do these measures go throughout a true clinical study where we can evaluate them in an unbiased fashion, and we can evaluate them to say that if I believe that drug X or product X can be used for whatever ailment that you want to use it for, where is the clinical studies that show that yes, it does? What percentage of patients does this actually work for? A lot of our reliance is on anecdotal, and the anecdotal evidence is fantastic. I mean, it's through the roof fantastic. But being able to safely say that to answer those questions is really where we see the importance. And I think, I'm almost done, Charlie. Be quick. And where we really start to see these questions is, I'm sure there's some physicians in the audience, is when we talk to physicians, which we have a great relationship with, their question always is, we always ask them, what do you think? What do you think about medical marijuana? What do you think about CBD? It's fantastic. We hear about it all the time. It's great. Our patients want it. Sounds wonderful. Excellent. Would you write a recommendation for your patient today? No, absolutely not. There's no clinical data. There's nothing that shows me, does this work? The really nice part is that we are shifting and more physicians are becoming open to it, which is great, because we want that. But I think to help kind of persuade the avenue and kind of help show that, yes, this is a very much a legitimate medication, and this really is taking a very positive avenue to really get this into more physicians' offices, doing more clinical studies, showing that each product has medicinal benefit for what they say it is. That's really what's key, and I think you're seeing a lot of products doing that. But this is really where we see our research in general going. And not only that, but looking at higher testing standards from medical marijuana testing labs. There's always going to be new laws. I know the state of Florida is working on what their testing facilities are going to be like, but making sure that products are what they say they are, making sure that you're getting exactly the dosage levels that you need to be receiving, and not only that, but also just ensuring that the product that you're getting, you know where the source is coming from. At the end of the day, we have a very strong belief in that this is a medicine. We believe it strongly as a medicine, and it just needs to now be tested and treated as a true medicine. And that includes doing preclinical studies, phase 1s, 2s, and 3s. So the cost is high, but like I said, the significance is higher in that. And that's pretty much it for today. Are we taking questions now, or wait until the panel? Wait to the panel? Excellent, excellent, excellent. So we'll wait for the panel, but thank you very much, appreciate it.
At the end, we'll have someone, I believe Gene will go around with a microphone and help to get your questions asked. Now, you can also write questions on these notepads here, and we'll collect them at the end, especially if you want to ask an anonymous question. There's no dumb questions, but some questions you don't want everybody knowing that you're asking. All right. Next, we have Dr. Wilkins. I'm not sure if she's here and ready to present. If not, okay. All right, great. Excellent. So how many physicians do we have here that's actively giving recommendations to patients now? Okay. And how many physicians are just thinking about it, just kind of come to the conference to get more information? Well, it's a pretty mixed group. Well, this is really the right session to attend. I'm glad you all stayed for Sunday, because part of what we want to do is show you some things, like Dr. Anderson just introduced, about the safety and efficacy of the medication, and encourage you to also work with the patient's other physicians, especially if you're treating something complex like epilepsy, Well, epilepsy is really not a condition itself. It's really more of a symptom of different syndromes, Dravet syndrome, Lennox-Gastaut syndrome. I'm not a specialist on epilepsy, but I have seen it as an anesthesiologist in terms of status epilepticus. And that's where the seizures just keep coming, and they're completely resistant to treatment, and the patient has to go under anesthesia to stop the seizures and give some brain rest. Because the patients can get permanent brain damage just from the electrolytes and the constant neuronal activity. But that was an excellent presentation, and who knows, maybe one day, as an anesthesiologist, we'll be given IV cannabinoids to help patients, undergo that period of brain rest and facilitating what the barbiturates do when we have them on a ventilator. So I believe Dr. Wilkins is going to walk in the next moment here. And what I'll do is I'll just go ahead and start just talking about her a little bit. I don't know her personally, but last year I had the pleasure of watching her presentation. She's a pharmacist. She's actively involved in research. She also is a naturopathic physician as well. And she's also, she's spoken at a few television shows, and I think she may have had a commercial or something else besides just TV and speaking engagements. All right, and as far as pharmacists, do we have any pharmacists here? All right, and out of those pharmacists that raised their hand, how many have patients that they know are receiving medical cannabis? Okay. All right, at the end, I'll be talking a little bit about drug-drug interactions and some of the cytochrome P450 interactions.